Hello and welcome. So, you're a nursing pro, and now you're stepping into the world of education. You're in exactly the right place. Look, you're an expert in your field, we all know that. But becoming a great educator, well, that's a whole different ballgame. Today, we're going to talk about that big leap, the one from being a content expert to becoming a real learning designer. And it starts by looking at that first impulse we all have.
Okay, be honest. When you get handed a new course or a lesson to build, is this the very first thing that pops into your head? What do I need to cover? It's totally natural. Our first instinct is to think about all the information we need to get across, like we're just filling a container. But what if that's the wrong place to start?
And this slide right here, this gets to the heart of the whole shift. On one side, you've got content coverage, basically an information dump. It's all about delivering facts. But on the other side, you have learning design, which is all about performance. It asks a totally different question. What do my learners need to be able to do when they're done with this? It's about ability, not just information.
So, let's actually put a name to this way of thinking. We're talking about making a shift to something called instructional design. And just to be clear, this is way more than just making pretty PowerPoint slides or organizing a syllabus. It's a real, systematic discipline.
Here's the textbook definition, but let's break it down. Instructional design is a systematic process. The two words that really matter here are systematic and measurable. This is all about being intentional. It means every single choice you make, every activity, every reading, every video, it's all there for a reason, all leading to an outcome you can actually see and measure. No fluff.
Okay, so if we're going to build these really intentional experiences, where do we start? Well, it all rests on one single non-negotiable foundation. It's the cornerstone of everything we do, and it's called the alignment principle.
Alignment sounds fancy, but it's actually pretty simple and so powerful. The best way to think about it is like a three-legged stool. The first leg is your learning objectives. This is where you define what a student has to be able to do. The second leg is your learning activities. This is where you give them a chance to practice doing that exact thing. And the third leg? That's your assessment. It's where you measure if they can actually do it. If any one of those legs is off, the whole thing gets wobbly, and honestly, it just falls apart.
Let's make this real. Here's a perfect nursing example. Say your objective is for a student to demonstrate sterile technique. Now, a misaligned assessment would be to give them a multiple-choice quiz about infection control policies. Sure, they might know the facts, but can they do it? No way to tell. The aligned assessment? You get them in the sim lab with a mannequin and a checklist and have them actually do it. That's the moment of truth.
And here's why this matters so much in our world. This isn't just some academic theory. When our alignment is weak, we can graduate nurses who know about a skill but can't actually perform it under pressure. Strong alignment, on the other hand, builds real competence. It sharpens their thinking, and, it directly impacts patient safety. The stakes are just incredibly high. Okay, so we know we need to align everything, but what are we aligning it to? To figure that out, we have to become expert diagnosticians, not of patients, but of performance problems. We have to find the real learning gap. So what even is a learning gap? It's really simple. It's the space between where a learner is right now and where they need to be. And notice that word again, performance. We're not talking about a knowledge gap. We're talking about an observable skill, something they're supposed to be doing that isn't quite there yet. And this is a classic trap we all fall into. We start with a big, broad topic like sepsis. But sepsis isn't a performance problem. It's just a subject. The real learning gap, the thing we can actually fix, is something specific and actionable. Like, nurses are slow to recognize early sepsis indicators during their assessments. See the difference? One is a library section, the other is a problem we can solve. But a great designer takes it one step further and asks a really tough question. Is this even a learning problem to begin with? Because sometimes the issue isn't knowledge or skill. Maybe the staffing ratios are unsafe. Maybe a key piece of equipment is always broken. Maybe the hospital policy is just plain confusing. And here's the hard truth. You can't train your way out of a broken system.
Now this is what a really solid gap statement looks like. It's so specific. It tells us who we're talking about, new grads. It tells us the exact performance problem. They're not documenting I&Os correctly. And crucially, it tells us why it matters. It's causing delayed clinical decisions. When you have this level of clarity, you can finally start designing a solution that'll actually work.
So far, we've been deep in the mechanics of design, but being a truly great learning designer is also about your philosophy. It's an ethical commitment. It means designing for every single one of your learners.
First things first, let's clear up a huge misconception. Inclusive design is not about making things easier or lowering your standards. Not at all. It's actually the opposite. It's about keeping your standards high, but systematically removing the unnecessary junk that gets in the way, like a confusing website or vague instructions that stop a perfectly capable student from showing you what they know.
So what does that look like day to day? Well, it's pretty practical stuff. It's making sure your online course is a breeze to get around in. It's providing a crystal clear rubric so students know exactly how they're being graded. It's using deadlines that help them plan instead of panic. It's making sure your materials work for everyone. These aren't just nice little extras, they're fundamental to good design. And we have to ask, why is this so critical in our field? Well, just think about our learners for a second. They're often working professionals. They're juggling 12-hour shifts, unbelievable stress, families at home, all of it. They come from all walks of life with all kinds of learning differences. Great design doesn't get surprised by this. It expects it. It builds a supportive structure right from the beginning. You know, when you really get down to it, this isn't just a good teaching strategy, it's a moral choice. When we design with empathy, when we create fair access for everyone, we're actually living out the core values of our own profession: respect, compassion, and service. We're honoring the dignity of every single learner. Okay, let's pull all these threads together. When you embrace this role, you're not just learning a few new tricks. You're really adopting a whole new way of thinking about what it means to be an educator. I get it. The default mode is to just jump in and start making things. Creating slides feels productive, right? But the professional approach, the designer approach, it forces us to hit the pause button. It demands that we slow down, that we think, that we diagnose the problem, and that we ask the right questions before we ever open PowerPoint.
So I'm going to leave you with this challenge. The next time you sit down to create a lesson, stop and ask yourself these 4 questions. 1, what is the actual performance problem I'm solving? 2, who are my learners really and what are their lives like? 3, what specific action or behavior needs to change? And 4, how am I going to know? How will I measure that the change actually happened? Answer those questions, and you're not just covering content anymore, you're designing learning.